Hi all, we'll get started here in a minute or two, let a few more people join us. All right, well, we'll get started and people can join as they enter in. Welcome to our COVID community conversation, straight talk about COVID-19. We'll be talking a little bit about the vaccines, the variants, and masking this week. And I'll have Dr. Barnabas introduce herself.
Good afternoon, everyone. My name is Roanne Barnabas. I'm a professor in the Department of Global Health and Division of Allergy and Infectious Diseases. A real privilege to be here today to talk with you in this community conversation about COVID. We are recording this conversation. All the information that I present is current of today, as of today, and we will be talking, in addition to what Callie mentioned about masking and vaccine updates and back to work and school, I'll also talk a little bit about flu shots because we want everybody to have all the information about flu shots and to be protected against the flu moving into the flu season. I'm really privileged to do this work, and I want to thank everyone who is here today. Please do ask questions. We go to school for a long time in order to be able to answer the questions that you pose, and it's our privilege to do so. And then I will also get through as many questions of the submitted questions as I can in the time that we have. Okay. So maybe I'll start with a few comments and a few updates. The first update I want to provide is about the annual influenza vaccination or flu, and that is recommended for everyone who is 6 months and older, with just a few exceptions. The flu vaccine is updated every year and was updated again. The reason I'm talking about it today is because September and October are good times to be vaccinated. And ideally, we want everyone to be vaccinated against flu by the end of October. That's because, as you know, it takes a couple of weeks for your body to develop antibodies against the flu. And so we want everyone to be vaccinated in good time. But it's hard for us to predict exactly when we might start to see cases of the flu. And we know that we might have a different type of flu epidemic this year, because last year we had actually fewer cases of flu because of all the precautions we were taking against COVID-19. So it might be that people have reduced immunity due to the lack of flu virus activity, and that could result it could possibly result in an earlier, and it could even possibly result in a more severe flu season. So while we are focused on COVID, remember that flu is coming as well, and we really want everyone to be vaccinated in September and October. Don't wait for flu activity to increase, because we want everyone to have antibodies on board before the flu season starts. With returning to work and school, we expect to see more cases of the flu this year than we did last year. So we need everyone to be vaccinated as soon as they can. Because COVID and flu are both respiratory illnesses and they cause many of the similar symptoms, we might need testing to be able to differentiate between the symptoms, and certainly being vaccinated will decrease your chances of having both infections. So I just wanted to provide that information about flu. I'm going to go on now to talk about COVID-19 prevention, especially in the context of returning to work and school. And I'll provide an update on the masking mandate from the University of Washington. When we think about how to prevent COVID-19, I want us to think about layers of protection. So an analogy that we can draw with this are that the injuries, illnesses, and deaths from motor vehicle accidents. And motor vehicle accidents have fallen dramatically in many settings and over many years. In the chat, can anyone tell me what are some of the reasons why we have seen a decrease in injury and death from motor vehicle accidents? What are some of the things we do to prevent motor vehicle accidents? Seat belts, traffic calming measures, seat belts. So yes, so this is a great example of how we layer on protection. Our roads are actually much safer. We pay a lot of attention to the speed limit. We pay attention to actually even the angle at which we build roads. We have calming circles so that people reduce speed, and we have seat belts, and many measures are built into cars to make them much safer than they are. And there's so many examples in our everyday life where we have multiple measures to protect us. In fact, car seats for children is an excellent example of an intervention that has really saved lives for children in cars. And any type of car seat that you buy, from a fancy designer one to an everyday car seat, they all meet the same safety standards. And in the same way, we need this multi-layered approach to prevent injury or morbidity and mortality, death from COVID-19. So we want to limit both the effects of having acute or chronic COVID, and we want to limit the number of deaths. So we need layers of protection. The primary layer of protection is the vaccination, which gives us excellent protection against acquiring COVID. And I will talk in a few minutes about specifically what the numbers are for vaccination protection against Delta. And I want to share those data with you, and I have some pictures to share with you as well. But you think about vaccination as being primary, so you think about that as your seatbelt, keeping you in the seat, keeping you safe. And then other layers of protection, masks are very similar to having speed limits. So you're much less likely to get in an accident in the first place if everyone is driving at the speed limit and you have many traffic calming measures. But if you do get in an accident, your seatbelt is there, your vaccine is there if you do meet COVID to fight that particular assault on your well-being. And then we think about other things we do, like social distancing and testing as additional measures. So maintaining the specific camber on the road in order to ensure that driving down it is safe, thinking about the angle and the distance between turns, all those additional measures, how we build the roads, those are very similar to having our other surrounding safety mechanisms in place, the social distancing and the testing. So at the University of Washington, we are, thank you, and thank you so much to Tina Blackman, 334474, and Saradwin and Deborah and TL1 Smith for all those excellent examples of ways we protect ourselves from motor vehicle accidents every day. And those have really made a big difference over many years for lives saved. So the University of Washington has reinstated already its indoor mask mandate as an additional level of protection. And so this is regardless of vaccination status. And this is for people who are in public and common areas such as lobbies, hallways, stairways, restrooms, elevators, and shared vehicles. UW Medicine clinical personnel continue to follow the UW Medicine policy, and masks are encouraged. And masks are required in UW Medicine. And in outdoor settings, here in a crowded outdoor setting, masks are encouraged and now required under Washington state guidance for meetings of more than 500 people. And so this multi-layered approach means that we can prevent COVID from spreading within our community. The main reason we take this multiple layered approach to preventing COVID is to protect the most vulnerable in our community. And this kind of action is really for the good of everyone around us, in addition to protecting ourselves. I'm going to switch now to talk about what the real risks are of acquiring COVID-19. And I want to leave just very clear messages for you here. And let me see, I'd like to share these pictures with you. So let me just bring this up here. Okay, great. So here's a very nice graph about the number of cases of COVID per 100,000 people here on the y-axis. I hope you can see my cursor. And then on the x-axis, the share of the population with at least one vaccine dose. And you can see here where vaccination coverage is very high here. So here in Massachusetts or California, the number of cases of COVID per 100,000 people is about 28 per 100,000 people. It doesn't quite reach 30. But if vaccination coverage is low, so here in South Carolina or Georgia, for example, the number of cases of COVID are quite high. And these are all data from, and we expect most of these cases to be Delta. These are all recent data. And I'll show you data in a moment also from King County. And you can see here, there's about a fourfold difference, approaching 120 cases per 100,000 when the vaccination rate is about just over 50%. So this is one of the main main measures we have protection, and we can see that it does work. And your risk of acquiring COVID is really much less if vaccination coverage is high. Here is the daily average COVID cases per 10,000 residents around Seattle. So if you're vaccinated, if you're fully vaccinated, the risk of acquiring COVID is less than 1 a day. And if you're not vaccinated, the risk is quite high, 10. And this is only of acquiring COVID. And most of these cases are asymptomatic. The most important message I want to give you today is this. In Seattle, on an average day, about 1 out of every 1 million vaccinated residents was admitted to hospital with COVID symptoms. And so this is not necessarily a severe case, but enough to be admitted to hospital. The risk is so close to zero that it's hard for us to process what it means. The best analogy that we can give is that this risk, if you're vaccinated, of acquiring COVID and being hospitalized is about the same as risk that you accept every day, for example, riding in a vehicle. So coming back to that risk of riding in a vehicle, if you're vaccinated, and these are data from King County where we have very good tracking of cases, vaccinations, hospitalizations, the risk if you're vaccinated of acquiring COVID and being admitted is about 1 in a million. So a very small risk. This is, and I want to share these data because everyone knows someone who's acquired COVID and has been vaccinated. And these anecdotal stories are so meaningful, but the real risk is reflected in understanding the data around vaccination. And so one more, I'll just make another important distinction about what we know now about Delta. Delta has really changed things, and we have been catching up. The science has been catching up, and we have understood in pieces what the Delta epidemic has meant for COVID-19. We first learned that the viral load for people who are vaccinated is very similar to people who are unvaccinated with Delta infection. And we were concerned that that meant they were equally transmissible. But more recently, we have data that show that even though the viral loads are similar, the virus behaves differently. And one analogy for this is to think about the viral load as in a vaccinated person faces the army of antibodies as a result of vaccination. And that viral load, even though that initial level is high, is quickly by antibodies. If someone is unvaccinated and they have the same viral load, then those viral particles, the virus can continue to replicate and travel down into the lungs and cause severe damage in the body. And so you can think about that as there is no defense against the virus if someone is unvaccinated. And then I wanted to just talk a little bit about how vaccination can protect children. And so I'll share just one more picture. So this today, or just recently from the CDC, here we can see we have seen an increase in children and adolescents who are not vaccinated. But if a state has low levels of vaccination, that rate of hospitalizations is much higher for states with low vaccination, four times higher compared to states with high levels of vaccination. So just coming back to the main message of we are getting vaccinated for the sake of everyone in our community. As we are able to drive up the proportion of people who are vaccinated, we have experienced fewer cases, there are fewer children who are infected, and we can protect everyone around us with these layers of protection in the same way that we have done for other important public health interventions. And those are the main prepared comments that I had for today. And I'm happy to take questions. And then I also want to answer some of the questions that are here on that we received. I did want to answer one question that was very important. It said, the question asked, can natural immunity provide better protection against the Delta variant than vaccination? And the answer to that question is no, not at all. I've shown you lots of data today that being vaccinated provides the best level of protection against Delta. In fact, thanks to high vaccination in Seattle, our risks of acquiring infection, the Delta infection overall, are much lower, and the risks of hospitalization are about 1 in a million for people who are vaccinated. Do we know if we need to get vaccinated every year? That we don't know yet, and I think that we're still waiting for further guidance both on annual vaccination and on boosters. The data are not clear, but there are several ongoing studies, including a vaccine booster study here at the UW. And as soon as data are available, we're testing that. And also the question about, does it have to be the same company? That study of mix and match vaccine and booster is ongoing right now at the University of Washington. And as there are additional guidance, we'll be sure to share that. But at the moment, it does not seem to be, at the moment, it's not recommended. And as we have more data and the studies are finished and we have the answers, we will share them. There was also a question about what injections are causing breakthrough cases. No vaccines are causing breakthrough cases. Breakthrough cases are caused by someone who is usually unvaccinated, who has an infectious case and who has infectious viral particles that they are spreading to other susceptible individuals, and that's how they acquire infection. Vaccinations themselves are not causing breakthrough cases. Then there was one of the questions asked specifically, what are the risks of returning to the office and the classroom. And that very much depends on background vaccination, which is why the UW is requiring vaccination and additional protection measures. And an average day in Seattle, your risk of being hospitalized with COVID after you've been vaccinated and have full immunity are 1 in a million, about the same risk as going about your normal life, and the risks of motor vehicle accidents and other things that we face. There are quite a few questions about how to talk to people about vaccine hesitancy. And this is such an important area, and an area where we as infectious disease physicians and public health specialists could do more. I think it's really key to listen to what the question is. And sometimes it could be very specific. So for example, one of the questions we received is a family member is hesitant to get the vaccine because they have fibromyalgia. And so there, I think the reassurance from a physician, and I can provide this, if you have fibromyalgia, it is very safe to get the vaccine. There is no impact of the vaccine on fibromyalgia. And certainly for people who have comorbidities, the vaccines are very safe and really acquiring infection, listening, providing the data, using the CDC website that also has good information, and then thinking about who is trusted, who can provide information that is really, really useful and that will be trusted by this person. Oh yes, so then there was a question about, and there's an increase in patients who are requesting letters for medical exemption. I think it's pretty clear that unless you have an allergy to one of the vaccination, one of the elements within the vaccine, and have Guillain-Barré syndrome or anaphylaxis, that in many cases, the exemption is not medically warranted. And I think in my practice, patients who don't meet the criteria for medical exemption, as a practicing physician, I do not give that because it is not part of, I cannot see the scientific or otherwise benefit to my patient. And for my patient, if there's no medical exemption, they really would benefit from the vaccine, and that would be how I would. That is indeed how I am handling the requests for medical exemptions. The conversation is very important because medical providers are trusted. Right. So then there's also a good question about what is the acuity for hospitalized children. So I am not a pediatric physician, so I don't know what the acuity is at Seattle Children's, but that's a good question. And Callie, maybe we could include that in the questions. I know that pediatricians and OBGYNs and others have done this, and they could maybe comment on the specifically on children. But I've shown you that if we're able to surround children with layers of protection, that the hospitalization rate overall is much lower. Yes, it's true that the vaccines are very safe and they are very effective. All the cases that are reported are investigated. So there is this question about, the risk of acquiring COVID is higher if it is higher than the risks of being hospitalized. We just have an unprecedented amount of testing, which is good. It's an extra layer of protection. So for the vaccine protection against asymptomatic infection is lower, but that is how vaccines work. The point of a vaccine is to shorten the duration of infection so that you have the antibodies ready to fight the virus. So the virus does land in the nasal mucosa. If you swab the nose, you can find the virus, but you have all your immune cells ready to fight the virus, and that really shortens the duration of infection. It means that your risk of being hospitalized with COVID is very low. It's down to 1 in a million. So the vaccines are working. So your risk of, you still have asymptomatic infection, and it's probably true of many other vaccines. We just don't test people as often for infections unless they're symptomatic. But that's the way vaccines are meant to work. They're supposed to just make the duration of infection much shorter. So I just want to make sure that, yes. And so it's true that more people are vaccinated, the more testing we do find people who have infection. And of course, the anecdotal stories of people having infection or being more symptomatic, we do hear those stories. But these are the data that I've presented today from King County, where we are able to track all vaccines, all tests, and all hospitalizations. Do you see COVID becoming a travel vaccine? When I do travel appointments for patients who are traveling, the first thing we do is check that all their regularly required vaccines are up to date. So all my patients, when they travel, they might come to see me because they are traveling to a malaria endemic area, but I definitely check that their tetanus is updated, and that if they are traveling to an area where they are at risk for hepatitis, that is also covered. And in general, the hepatitis vaccines work very well. So I try to make sure those are covered as well. If they are due for their shingles vaccine, I make sure that they have it before they travel. So I don't think it will necessarily be a travel vaccine, but just a vaccine to protect us. We have benefited so much from vaccines. In fact, we don't see the under 5 mortality from other infectious diseases, common childhood infectious diseases, thanks to vaccination. Oh, so there's a very good question about the Mu variant and its potential to evade antibodies. I did look just before giving this talk. We still are waiting for data on the Mu variant, but it will be an evolving story. And so this is also important. We first heard about Delta. We didn't have all the information that I was able to present today. We now have good systems in place to collect data and can present it as it becomes available. Thank you, Elena, for using the analogy about seatbelts and speed limits and the way we build our roads to have a safe camber. We are so fortunate. We live in a society where we open the tap, we get safe water. We buy food with so many mechanisms are in place to make sure the food we eat is safe. And when we travel by road, by car, by plane, that's also safe. And in the same way, we can introduce these layers of protection around us with the primary purpose of us returning to the meaningful activities in our lives that make it fun and make us happy. And so all these layers of protection will help us. In my medical practice, it's my main goal is to help my patients be well enough so that they can do what they want to do and think about other things other than their medical illness. And certainly COVID has taken that away from us, but with all these layers of protection can help us get back to the things that give our life meaning. We're just at 12:30. I'll just give a very short answer to this question about mandatory COVID shots. We expect that our doctors and other healthcare personnel. I definitely speak for myself as a physician. I don't want to do harm to any of my patients. So I make sure that all my vaccines are up to date, especially my vulnerable patients. And so I think that has been required. And in fact, even when I have people who are interested in entering the medical profession and come and shadow me, and even all volunteers at UW-MC, everyone has to have all their regular vaccines up to date, hepatitis B and all their testing up to date. And that's to protect other people. So this is, and I think it's reasonable for patients to expect when they come to see a doctor that no additional harm will be done, and we will take care of them with all the best science and tools available, including vaccination and vaccination for ourselves. Kelly, I'll hand it back to you.
Yeah, great. Thank you so much, Dr. Barnabas. We appreciate you coming to help us all understand what's going on and learn a little bit more. So thank you for being with us today. If you have any other questions, I will drop a link in the chat that you could submit your questions to. So thank you again. And we will have another session the following Friday. So Friday, September 17th. There is a Spanish session this Friday at noon. So thank you so much. Have a good day.
Yes.